Welcome everyone to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner, and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. Really excited today to talk to you today about lifestyle medicine with our special guest and my new friend, Dr. LaTaya De Jesus. I think I got it.
You did great. Thank you.
So today we're going to talk about lifestyle medicine. And it's been around actually for a while, but I think amongst the general public, it's still kind of new. And so I'm really excited because so often we talk to you guys about making these lifestyle changes so you can avoid certain things like high blood pressure, diabetes, obesity, and among pretty much every episode, we pretty much talk about it. And so today we'll be able to get into more detail on what is lifestyle medicine, how is it different from conventional medicine, what is a visit like with a lifestyle medicine provider. We'll go over costs and insurance coverage, who's an ideal client, some common misconceptions, what people are surprised to learn about it, and where you can start if you're interested in trying it out. Before we get started, I just want to remind you that this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you can call 988. Well, Dr. LaTaya, welcome to the Melanin Initiative.
Thank you. Thank you for having me.
We're so excited and really honored that you would take some time out of your busy schedule to spend time with us and share with our audience a really important option that's available to them. Before we get into our questions, we want to get to know you a little better. If you can, tell us a little bit about where you're from, your family, and what you do when you're not on podcast.
Absolutely. So I am certified in lifestyle medicine. I'm a nurse practitioner. I also work in primary care 2 days a week. I live with my husband and we have 5 boys, and the dog is a boy as well. We live in Cutler, Ohio, which is a small little country area near Athens and Marietta, if anyone is familiar with that area. So in our main time, we love to play board games. I enjoy sewing and I really enjoy reading and writing. I recently wrote a book, which will be out this year. And then I also, me and the children, we also like to work out. Well, my husband as well. We also like to work out, stay fit, cook. Our list goes on.
So you practice what you preach then, sounds like.
Yes, yep.
Congratulations on the book, by the way. Is that one of the resources you provided me?
No, actually, it's actually in a different category. It's a religious book.
Oh, well, hey, the audience might be interested. This is an opportunity for promo. So share that with me after we finish, and I'll put it in the description box. Okay?
Absolutely.
Yeah, because actually we just started a series at the time of this filming called Faith in Medicine. Because they're so closely related. There's a lot of research out there on how having a spiritual or religious practice helps people receive information, cope with different diseases and diagnosis, grief, anxiety, a number of things. And so one reason we had mentioned it in our episode that we talked about it was because when we admit people to the hospital and when they go outpatient, we might ask them, do you want to speak with a chaplain? So we kind of went into why that we have that conversation with people, because a lot of times they're kind of confused because they think that maybe they're dying and we haven't told them enough. And we want them to know that they're just another person on their medical team.
Right. Absolutely. There's absolutely so much research out there that connects the two. So I really love what y'all are doing there.
Yeah. Okay. So let's get started with our, you have your children and you told us today that you rescue cats, right?
Well, I'm not a cat rescuer. The cat the cat just ended up on our property. So we took the cat in. Yes.
Okay, well, we wish you all is there anything that the audience can help you with in helping you with this cat?
Well, if you want to send up prayers, if you pray, that'd be great.
Aw. Okay, so let's jump right into our questions. I'm going to we love slides here at the Melanin Initiative. And actually, we want to learn about your education real quick. We can't let that slide. Yeah.
Yeah,
So tell us
absolutely.
about your a quick little summary of your nursing journey.
Okay, yes. So I actually started when I was in the military. I was a medic, and I got out to go to nursing school. I went to Florida International University in Miami, Florida. I was part of a program that was only for prior service members. So I worked in emergency services for the majority of my RN career because that was my background in the military. Then I decided to become a family nurse practitioner because of seeing so many people, so many return people in the emergency department coming back in for diseases that could be reversed. So I decided I wanted to be someone else's primary provider so that I could then help them not to be like a return patient in the emergency department and teach them how they could make lifestyle changes. So I went back to school. I went to the Ohio State University to get my master's and my doctorate in nursing. And then I got certified in lifestyle medicine because that's been my passion. And I think that kind of covers it. Here I am today as far as my nursing journey goes, my nursing career.
Wow, this is awesome. So thank you so much for your military service. I am a military brat. I grew up on Quantico. My dad was a drill instructor and retired from the Marine Corps.
Awesome. Yeah, thank you for his service. You passed that along.
He's a big fan of the show, so he'll definitely be leaving some at least one comment in the description box.
Awesome.
What was your DNP project?
So I wanted it to be regarding lifestyle medicine. I could not work that out. So I actually did my project on uh, telephone triage. So people who like the front desk staff not really knowing a direction to send patients when they call in. So I created like an algorithm
Oh,
and well, I adopted an algorithm, made some changes, and then I used that as for my project, and it worked out really well. And actually, yesterday, a couple days ago, I was asked to provide the algorithm to a different office because it went so well during my project. Yeah.
oh, congratulations. How long ago did you finish?
So this was in 2022.
Oh, wonderful. Yeah, I graduated then too.
Congratulations, or
Yeah, thank you.
give me
So
a high
yeah.
five over here.
Oh, yeah, thank you so much. Yeah, at the time of this filming, we actually rolled out a series called Becoming Doctor of Nursing Practice, and we're following a gentleman by the name of Demetrius Kirk. He's in the
Yes,
program now, and we'll be following each semester, so we can just learn more about what that journey's like, and the public will be able to increase awareness amongst the public, as well
yes,
as nurses
awesome.
and patients.
Yeah.
A lot of patients say they didn't even know the degree existed. We know a lot of our colleagues in healthcare feel that patients are confused by those letters, and so we just want to bring awareness and attention.
Yes, and it's good like, if you work with a provider who, like the physician I work with, she explains that she calls me doctor to the other patients, and she explains the difference, as well as I do myself. But yeah.
Wow, that is a wonderful place of practice. So let's jump into it. We have your slide here. So if you can just tell us, what is lifestyle medicine?
So lifestyle medicine is amazing, first and foremost, but it is a therapeutic lifestyle intervention that is treated as the primary modality or treatment for chronic diseases. Some of these chronic diseases can be heart disease, cardiovascular disease, type 2 diabetes, obesity, hypertension, just to name a few. But we use the 6 pillars that you see here on the screen. That includes a whole food, plant predominant diet, physical activity, restorative sleep, stress management, the avoidance of risky substances such as alcohol and uh, recreational drugs and tobacco, and then also positive social connections. And when we use these pillars, we are able to then help our patients or clients to reverse chronic diseases, and if not at the very least limit the amount of medication that they are on or prevent the need for medication in the future.
Wonderful. That's a great segue into how is lifestyle medicine different than conventional medicine?
Yes, so lifestyle medicine is, it kind of goes hand in hand with conventional medicine in that as providers, we are trained and taught that we are to use lifestyle intervention first. It's just that many of us don't know what we should be telling our patients when we say, okay, make lifestyle changes. So lifestyle medicine steps in to then be able to explain those lifestyle changes that people should then be making. Now, there's a difference though with lifestyle medicine and conventional medicine, because conventional medicine tends to treat, or rather put a band-aid on diseases, and it's only one disease at a time. So if I have high blood pressure, you're going to give me a medication for high blood pressure, but that medication may not cover my diabetes, right? And then lifestyle medicine, it actually gets to the root of the problem, which then when we address the root cause, actually affects several other diseases that we may have or may not even know we have. So if I'm a lifestyle medicine provider and I'm treating and this is absolutely the case, right? I'm treating my patient for one thing. I'm going to let them know, hey, well, based off of us going this route, this will also treat your high blood pressure and your high cholesterol, because you want to get your diabetes checked or treated naturally or through lifestyle medicine. It's going to, by default, a good side effect is that it's going to treat those other diseases as well. Whereas like in conventional medicine is giving you a pill for each individual disease.
Yeah, that's wonderful. I love the way you explain that. How long has it been around?
Oh man, over 20 years now. Yeah, it's just like, I think we were talking off camera, it's just not been as mainstream, and it's just becoming mainstream with the public. So, and still not a lot of people know about it, but it's gaining traction. It's gaining traction. We have big names like Dean Ornish and Michael Greger, who are part of lifestyle medicine. They're considered like founding fathers within lifestyle medicine. So
Awesome. Two things you said that I love. One, you used the word high blood pressure, which I'm on a mission. I mention it as often as I can to get us as clinicians to not use the word hypertension when we're talking to patients in the public, because they don't know what that means.
correct.
But when you say, because they're associating with the feeling of being hyper, and they don't feel hyper, so then there's no problem, right? They don't take their medicine. They don't need to check their blood pressure. So I'm on a mission to get us to use the word high blood pressure. And so thank you. And then two, I love that you said something that I often say is a disease is not a destination, and that you still have the power to make choices, and there's still an opportunity to make some changes here.
Absolutely.
So what's a visit like with a lifestyle medicine provider?
So it can vary from provider to provider. So you have two ways to get in contact with a lifestyle medicine provider. I know we're going to get to contact later, but if your primary care provider is a lifestyle medicine provider, you already have a good start. So I have my patients and they come in. If I just had a gentleman, he came in, he's newly diagnosed type 2 diabetes. And so now I can have this discussion with him. So the visit, you asked the question, what is a visit like? So with your primary care provider, the visit is that they're going to ask you certain questions that you're not going to necessarily normally be asked. They're going to ask you about your sleep. They're going to ask you about what exactly you're eating. They want to know specifically how many fruits and vegetables you're getting. Okay, how many whole grains are you getting? How many servings of legumes are you getting in? How much water are you drinking? It's not simple questions as of, are you eating a balanced diet? Because some people's definition of a balanced diet is different than my definition of a balanced diet, So we kind of dig in there a little bit more. How often are you working out? Okay, 2 days a week. How long are you working out? Are you able to talk when you're working out? We'll kind of we dig in, because we need to dig in order to be able to then formulate a plan for you based off of what you're currently doing. And so that makes the visit different. And then you're going to be approached with, hey, let's try this lifestyle change first. Are you willing to make these changes? Are you able to make these changes? Is your life set up that you're able to put this into your daily activities, right? And then we'll bring you back. We'll bring you back sooner. So they're not going to put you on a pill and then tell you the follow-up in 3 months. They're going to give you this lifestyle change and tell you, hey, I might give you a phone call in 2 weeks to see how things are going. Or I'm going to bring you back in a month so we can see how things are going. If you are visiting or seeing a lifestyle medicine provider who is not your primary care provider, but they have like their own lifestyle medicine practice, then you're going to spend a lot more time with them. You're going to spend about an hour and a half, maybe 2 hours with that provider, because they're going to ask you again a lot of detailed questions to kind of get a better picture of what's going on in your home. It'll even extend over into who does the cooking, who does the grocery shopping. Is your spouse or significant other willing to come to these appointments? Because it technically is a whole family thing. We got to make sure that you have that support system. And then those providers, they absolutely do see you more often because they kind of follow you closely, so that you do have at least the one support, which is through the provider, knowing that they're following up with you. And more people are likely to follow through with their commitments or their goals when they know that their doctor or their provider is going to be reaching out soon. So that's how the visit normally starts. And then as you continue on, whether it's your primary or whether it's a independent lifestyle medicine provider, they will eventually want to draw some labs, relook at labs and say, okay, well, we need to start taking you off of these medications, or hey, you don't even need these medications. Look how great you're doing, you know? So there are times where situations are, there's a need for medications, and we're not against medication at all. So if your blood pressure is a 180 and above and is consistently like that, we're going to definitely educate you on lifestyle changes that to be made, but we're probably going to go ahead and still put you on a medication in the meantime, because we still want to do the best for you. And right now that medication is what's going to be helpful for you at this time, especially if you're symptomatic, and again, if it's so high. But we do expect that as you're making those changes, we're going to be dialing it back. The goal is to get you off the medication.
I like that. You've made a lot of really clear distinctions between lifestyle medicine and conventional medicine. And so I appreciate you pointing out those examples. So let's get into the cost and insurance coverage options.
Yes. So that's a little tricky. We're doing better. Lifestyle medicine was very hard to be covered before, but now people with Medicare can get lifestyle medicine covered at this time. Now, there are independent providers that do cover lifestyle medicine through private insurance. So like myself, I'm starting to take insurance, like private insurance. The best way to get lifestyle medicine covered, though, is to join a group visit. Those group visits are very well covered through insurance, whether it's Medicare or a private insurance. So if people are interested in lifestyle medicine, they can absolutely join those what we call shared medical appointments or group visits. And they're very they're offered a lot because we know how lifestyle medicine is still in its way of working to be covered through the different insurances. So that's kind of how we do it right now. But if people do pay out of pocket, and depending on how often they're being followed with, it can be pretty costly at this time. So like I said, the best option is to do those group visits, because you still get one-on-one time with the provider, and you also get the support of everyone else in the group, and so that's always a plus.
And could you just explain what you mean by group visit?
Yes, absolutely. So some lifestyle medicine organizations, they have group visits that are specific for, like, maybe it's high blood pressure or maybe it's diabetes. So then you would join those groups that are specific to the disease. However, there are groups that cover everything, because as I mentioned earlier, getting to the root cause of lifestyle medicine will technically cover so many of the diseases. Getting to the root cause of a disease with lifestyle medicine will cover, a lot of the other diseases as well. So group visits usually are small in nature, maybe 15 people that are there. And then at the group visits could be for an hour to 2 hours, depending on what facility you're going to, and you meet with them. Usually it's once a week, and you go. They usually teach you cooking. Sometimes they're live demonstrations, and then they will have an interactive, like I don't want to use the word lecture, but or lack of a
Presentation.
better word, yeah, presentation, but it's very interactive where the people of the group can ask questions. They may be asked to give feedback on a slide, but it's really designed to educate the people that's a part of the group on how they can make lifestyle changes. And so again, it just kind of progressed week after week. Some some of the visits can be 7 weeks long. There are 10-week programs. There are 3-week programs. I'm not sorry, 3-month programs. I think in California they actually have where you can stay there for 2 weeks, and yeah, and I'm sure there are other places that do the same thing.
Oh, okay.
Does that
So when
answer
you
your
say
question?
group, you mean other people, other clients, other patients.
Absolutely. Yep.
Oh, but do you, in that group setting, do you have the opportunity to have one-on-ones?
Yes. So you do the provider will pull you away to talk with you individually. Yes.
Oh, okay. That's really cool. I think I may have seen a few videos actually of that online. Okay, and so who's the ideal client?
Well, everybody's ideal client, right? So people who want to, avoid certain diseases, that want to never be on medication, who want to prevent, right? So we have the preventative people. We have the people who just found out about something, and maybe their provider didn't put them on anything right now because maybe they were adamant, the patient themselves were adamant that I'm going to make some changes and they just don't know how. So we have those individuals. We have people who have been on medication for many, many, many years and they're tired of it. And then we have people who just were not told that they had another option, and they want to, and once they're kind of, their eyes kind of glow because they're like, well, there's something else I can do. No, I don't want to be, I don't want to be like this. So everybody is really the ideal patient. But if I had to give one, so in primary care, when I see patients, I usually, the people who are newly diagnosed, I really try to talk to them a lot because it's fresh. Most of them are scared because they've never had whatever it is that they now have been diagnosed with, and a lot of them aren't on medication at all. So those patients, I try to talk with them to be like, okay, well, we don't necessarily have to put you on medication. There are other options. And so that's one of the ideal clients. And then someone else is the person, like I said before, who's just, they come in, they're like, I can't even keep up with when I'm supposed to take this medication and that medication because I take so many, and I wish I could get rid of some. Those are one of the key words. I wish I could get rid of some of these medications. And that kind of opens up that conversation. And so,
Yeah, that's wonderful. And I think, even though to us it seems obvious, excuse me, I think for patients, they don't hear enough that there are other options. And actually, I know for a fact, because so often I would tell patients, this isn't a prison, you have options. And they would so often tell me, what options do I have? Or I don't have a choice. And I would always tell them, you always have choices. Excuse me. And I love what I like to point out, which I think maybe we don't tell patients enough, is that particularly if we were giving them a prescription, that in most cases, these are not cures, right? If we
correct.
write this prescription this one time, we will have to keep writing it if you don't make these lifestyle changes. And so especially when I'm talking about high blood pressure, also we have really good medicine and science, right? Just like we have really good tape. And if there's a crack in your wall, we can put this tape over that crack in the wall and it will work for a very long time. But that crack is still in the wall. So if
Right.
there's water leaking, eventually, it might be 10 years, it might be 20 years, it might even be 30 years. But eventually, that really, really good tape, just like that really, really good medicine, isn't going to work. And you're still going to
Absolutely.
have to address that problem, especially if it's gotten worse. And in most cases, if it's been hiding behind the tape, it's gotten worse. We just haven't been able to see it.
Absolutely. You're absolutely right. And we use that as a example. Like maybe you've seen the picture of the water faucet being turned on. it's flooding, it's overflowing in the kitchen, and all this water is on the floor, and there's a person mopping, trying to mop up the water, but they haven't turned off the faucet. And lifestyle medicine is here to turn off the faucet. We're not just here to mop up the water, right? So
Oh,
you made a great point there.
I like that one too, though. Yeah, that was a good one too. So, what are some common misconceptions that you hear?
So I won't say that I hear them because not a lot of people are familiar with lifestyle medicine, but they tend to think it's similar to functional medicine. And while functional medicine has its place, it is different than lifestyle medicine. There are a lot of providers who are certified in lifestyle medicine who used to do functional medicine. And so the difference with functional medicine or lifestyle medicine compared to is that we're focused on the things that you can actually do in your life. We're not heavy on supplements or other type of, obviously if somebody's deficient, we're going to have you take supplements because you're deficient in an area, but we're not removing something or suggesting you remove something to then replace it with a supplement. The other thing is that our testing is not as I won't say detailed, but functional medicine has a lot of different testing that they do when you go into their office versus lifestyle medicine, where excuse me, we're learning more about what you are physically able to do because we might want you to be physically active, right? And then learning more about your family and your background, what you do for work. We're kind of delving in there, and we want to then bring into your life the things that are going to help you aid in your health or your recovery. And so that is a difference between those two. And so we're not at all functional medicine, even though functional medicine is trying to get to the root cause and lifestyle medicine is trying to get to the root cause. And there's an aspect with functional medicine that they talk about nutrition as well, absolutely. But we kind of take a different approach to certain in how we get there. Additionally, there's extensive research behind lifestyle medicine. There's so much research and studies, prostate studies, and how they turn off the cancer. So for your audience, there are genes that can make us put our risk of prostate cancer higher, or men's, right? And then lifestyle medicine has shown that we can actually turn those genes off so that you're no longer having that high risk. And so there's just so much literature, so much evidence, so many studies out there that show lifestyle medicine and it's and what we do as proven.
And what you're talking about, would you refer to that as like epigenetics?
Absolutely, yes.
Oh, okay, wonderful. You gave me a great idea. Actually, we need to delve into that a little bit more. And you really helped me because I was very familiar with functional medicine. As I had shared with you prior, I did a rotation in functional medicine in P school. So yeah, I learned all about the supplement world,
Yeah.
probiotics, prebiotics, stool testing. Sleep was a big one. The really long 30, 60-minute visits, lots of weight management. So you really helped me actually see the difference there. So I appreciate that because our audience might not know, but nursing is described as a holistic practice, and the things you're talking about really are a perfect example of treating the whole person.
Absolutely. Yeah.
And actually, these are the things that people, and so we spend a lot of time trying to explain to patients medicine and science, but these things you just named, sleep, stress, weight, those are the things people already know. Those are the things they're usually asking us about. And because we have to spend so much time talking about these prescriptions and these side effects, we don't have the time to talk about the things that they actually are asking about.
Right. Right.
And so, did we already talk about what people are surprised about?
No, we have not. So people are usually surprised that lifestyle medicine is an actual part of medical care,
Oh.
right? That is actual, like we actually get certified in this, and like board certified is probably my hardest exam that I took, and I cried for joy when I got it. Was like my most coveted certification.
Oh,
and and so, but they're also surprised to learn that you don't actually have to be whole food plant based. Now we do promote that, but it doesn't mean that you have to do that. We work with you. And so we're not here to tell you what to do. We work together with you. So we share in the plan for you. And so if you're thinking about lifestyle medicine as an option, uh, you don't have to be scared because we're not here to tell you, hey, you have to do this, this, and this. So you may remember this, Dr. Madison. There's been times where in the past, providers kind of tell their patients what they are going to do. And it wasn't kind of like a shared decision made. And then you have the generation of people who are like, well, whatever my provider tells me, that's what I'm doing, right? My father was one of them until I told him to like ask questions, ask questions. But yes, so with lifestyle medicine, we're kind of coaches. Like I know a lot of physicians they that do lifestyle medicine, they've mentioned that they kind of have to step out of their physician role and be like a coach, kind of like a friend role, and that can be a difficult transition. And then some of them didn't have that problem, but I've heard that amongst a lot of lifestyle medicine physicians. Whereas, as nurse practitioners, we kind of had that upbringing, as I would want to describe it, in nursing, that we kind of teach anyway. But you do not have to make these drastic lifestyle changes. We kind of walk you there. You don't have to do everything at one time because it can be overwhelming. We're here, and maybe we'll start with nutrition, and then maybe we'll add on physical activity, or maybe we'll add on sleep. It just depends on the person, you know. And so it's not a jump head first. We are here to support you. And that's part of the reason why we ask so many questions, because then we're able to know, okay, well, is this patient ready to commit to this level? Or do they need to start here? Or even do they need to start here? Do we need to hold their hand a little bit more and kind of walk them through it? So I just tell, don't be overwhelmed. If you want to still eat meat, by all means, let's still eat meat. But we need to add some things onto your plate that you might not have been eating before. So it's not about giving up your entire life or background or eating different than your family, because that's a big thing in the African American community or the Hispanic community. And we have ways to help you modify your foods where you're still eating the foods of your culture.
beautiful. And you've done a wonderful job today walking us through what it means to have a visit, the whole background and foundation of the practice, and what it's like to be a patient. So where should someone start if they're interested in finding a provider?
Yes, absolutely. So the first place I normally tell people to start is the lifestylemedicine.org website. They can look for a provider there. There's a drop down where there has a list of different options, and finding a provider is one of them. Another great place where people have found me is the Physicians Committee for Responsible Medicine. And I think, Dr. Madison, you're going to put those links in the chat. Okay, awesome. So there you can find a provider as well. And so those are the main two where majority of lifestyle medicine providers are registered there, so that they can be located in the different states.
Excellent. And so we're going to put also how our guests can connect with you. Is there anything else you want to leave them with before I do our sign out?
Not as far as connecting with me, but I do want to let your audience know that there again are other options, and lifestyle medicine is one of those options that you will not be disappointed by. I've not had anyone be disappointed, and I say that confidently, that you will not be disappointed.
Wonderful. Thank you so much. And everyone, if you love what she's had to say, then stay tuned. We're going to have her back, and she's going to share with us her own practice in an upcoming episode. Today, we learned about what lifestyle medicine is, how it's different from conventional medicine, what a visit is like, She was really kind enough to talk to us about cost and insurance coverage because that can be a really big barrier to people receiving the care. And so that's an area we like to talk about as much as possible. We learned that everyone's an ideal candidate or client. We addressed some common misconceptions, which were really enlightening for me personally, and where you can start to find a provider. Remember, you can email us your questions or show ideas to tmi.melanin@gmail.com. Subscribe to our YouTube channel and rate us on the Apple and Spotify podcast. It really helps you support the show and it gets the message to all those who really need to hear it. You can find all our social media links in the resources, and then anything we brought up today will be in the description box as well. Follow us on Instagram, TikTok, and Facebook. Remember, we release a new show every week on TMI Tuesdays at 10 a.m. on all your favorite podcast apps and here on YouTube. Follow, like, and share our content with all your friends. We thank you so much for watching and listening. Thank you, Dr. De Jesus.
Thank you. I appreciate it, Dr. Madison.